Hi, my name is Maria, and I will be presenting an Addison's disease. Addison's disease is a rare but serious adrenal gland disorder in which the body can't produce enough of cortisol and aldosterone. Me and Elizabeth chose this disease because my uncle on my dad's side has it, and we wanted to further investigate what causes it. I will first start off by explaining the physiology and pathophysiology, as an understanding of this will enhance my discussion of the symptoms. The organ system affected by Addison's disease is the endocrine system. Specifically, the adrenal glands are damaged and do not produce sufficient amounts of aldosterone and cortisol from the adrenal cortex that is needed to affect other organs and promote homeostasis. The hypothalamus releases corticotropin-releasing hormone. CRH then stimulates the pituitary gland to release adrenocorticotropic hormone. The ACTH stimulates the adrenal glands to produce and release corticosteroid hormones from the adrenal cortex into the blood. An important corticosteroid is aldosterone, which is produced by the zona glomerulosa, the outermost zone of the adrenal cortex. Aldosterone affects the sodium and potassium ion equilibrium in the body. A higher production of aldosterone increases sodium retention and potassium secretion, which as a result increases water levels and in turn leads to a higher blood pressure and volume. Another important corticosteroid is cortisol, which is produced in the zona fasciculata, which is placed between the zona glomerulosa and zona reticularis of the adrenal cortex. Cortisol is often released in higher amounts when your body is under stress. It triggers a flood of glucose that supplies an immediate energy source to your large muscles. It also inhibits insulin production so that the glucose won't be stored but will actually be available for use. Cortisol also narrows the arteries, which leads to higher blood pressure to increase blood and oxygen circulations. When homeostatic levels are reached in the body, negative feedback mechanisms kick in, and the hypothalamus and CRH secretion, and ultimately the endocrine pathway for the adrenal cortex. In this slide, I'll be explaining the pathophysiology. Addison's disease is a chemical deficiency which can be biological and is caused by damage to adrenal glands from risk factors, which I will discuss on the risk factors slides. The damage causes adrenal glands not to produce enough of the hormones cortisol and aldosterone, and ultimately lead to these problems. Mineral-corticoid deficiency is when your aldosterone is low. When your aldosterone levels are low, this increases sodium and water loss and causes a decrease in your ECV, which decreases your cardiac output. This is the amount of blood pumped out of each ventricle in 1 minute and can lead to a stroke. Low aldosterone levels can also increase the amount of sodium excreted from your body and can lead to hyponatremia, which is when the body craves salt because of the lack of sodium in your body. Low aldosterone levels can decrease the potassium excretion, which can lead to hypokalemia, and can cause heart problems because your heart has to work faster. Glucocorticoid deficiency is when your body's cortisol levels are low. Hyperglycemia is the condition in which your blood sugar is lower than normal. Low cortisol levels can also affect blood pressure because of the permissive effects cortisol actually has on the blood vessels. Low cortisol levels decrease the mobilization of fats and proteins, which leads to weaknesses and fatigue seen in patients with Addison's disease. On this slide, I will continue explaining the common symptoms of Addison's disease, which include, but are not limited to, bronzing of the skin, weight loss, fatigue, weakness, salt craving, and hypotension. The bronzing of the skin is due to the high levels of ACTH, which actually overstimulate the melanocytes and increase the production of melatonin, which causes the skin to overall darken. To make a diagnosis, doctors can check for any brownish discolorations in the creases of your palm, your elbow crease, on any scars, your lips, and gums. Fatigue and weight loss is due to the fact that both cortisol and aldosterone affect blood pressure. When your blood pressure is too low, you feel weak and exhausted. It appears to involve the tendency of cortisol to counterbalance leptin, the hormone that regulates fat tissues, and to stimulate ghrelin, the appetite hormone. When you have no energy and no appetite, you tend to eat less, so you fatigue faster and lose weight. Salt craving results from the decrease of sodium in the body, either from the inability to retain salt or the excess loss of sodium from the body due to the low levels of aldosterone. Another important symptom is hypotension, which is low blood pressure, and this is caused by the insufficient levels of aldosterone that are needed by the body to increase blood pressure. The doctor can try and make a diagnosis by checking for this symptom. The doctor would test for low blood pressure when the patient's lying down and shortly after they stand up to see if the low blood pressure remains when they change position. Addison's disease symptoms usually develop slowly over several months. Often the disease progresses so slowly that symptoms are ignored until a stress such as an injury occurs and worsens the symptoms. To make a diagnosis, the doctor will look at the patient's symptoms as well as run some tests. The doctor will usually ask for the family history because some people with certain genes are likely to develop autoimmune disorders and therefore are at a higher risk of developing Addison's disease. If that person or a close family member have vitiligo, which are these pale white patches on the skin, type 1 diabetes, or hypothyroidism, it usually means that they might are at a higher risk for developing Addison's disease. In the previous slide, we explained why the doctor would examine the skin for brownish discoloration and test for low blood pressure. The blood tests can be run by a hormone specialist and are looking for low blood pressure, low levels of aldosterone, a high level of ACTH, and low levels of glucose, as well as positive adrenal antibodies, which are antibodies that attack the adrenal gland. A synectin stimulation test, it uses synectin, which is a synthetic copy of ACTH. When synectin is given, the adrenal glands should release cortisol and other steroid hormones into the blood. A blood sample will be taken and tested for cortisol before an injection of synectin is given in the arm. Further blood samples will be taken after 30 minutes and after 60 minutes. If the ACTH level is high but the cortisol and aldosterone levels are low, this usually confirms Addison's disease. On this slide, I will discuss risk factors that can lead to Addison's disease. Like talked on the previous slide, there is a genetic predisposition to Addison's disease. However, less than 0.001 of people who are predisposed actually get it. There's a higher chance to get Addison's disease if that person has the genes for an autoimmune disorder. An autoimmune disease is a malfunction of the immune system which causes the body to attack its own tissue. The immune system makes some mistakes and attacks and destroys the adrenal cortex as if it was an infection. Damage to the adrenal cortex or medulla is what causes Addison's disease, and this can also be due to sepsis, which is an infection of the bloodstream, which can ultimately damage the adrenal cortex, cancer, and tuberculosis if they also target the adrenal cortex. 7 to 20% of cases are due to tuberculosis, and autoimmune disorders are responsible for 70 to 90% of them. The remainder of them is caused by infectious diseases, such as possibly sepsis. The only real way to treat Addison's disease is with hormone replacement therapy. The medication, usually oral corticosteroids that mimic cortisol and aldosterone. Hydrocortisone, prednisone, and methylprednisolone replace cortisol and are given a schedule to mimic the 24-hour fluctuation of them. Fludrocortisone acetate replaces aldosterone. The doctor will also recommend that the patient ingest plenty of salt in their diet to make sure that their blood pressure is high. The advantage of this treatment is these hormone pills do not have any side effects, but the disadvantages is the patient will have to take 2 to 3 pills depending on the doctor's treatment plan every day for the rest of their lives. If the dose of the pills is too high, there is a risk for weakened bones, mood swings, and difficult sleeping. These replace the normal cortisol and aldosterone in the body and basically mimic what they would do. In conclusion, Addison's disease is a rare adrenal gland disorder in which the body can't produce enough of cortisol or aldosterone from damage to the gland from autoimmune diseases or infectious diseases like tuberculosis. Its common symptoms are bronzing of the skin, weight loss, fatigue, weakness, salt craving, and hypotension. It's diagnosed primarily by looking at symptoms, running blood tests, and a synectin stimulation test, and is treated through hormone replacement therapy.